No problem.
There we go. I'm Erin Bickers. I'm your new Charlie. I'm with DMS, and I will drop my email address in the chat for anybody that needs to reach out to me, and I will turn it over to you guys. Thanks.
Thanks, Erin. Glad you're here. Appreciate it.
Thank you. I'm glad to be here.
Just keep us on target. And I saw Leslie Hoffman on.
I'm on. Good
How are
morning.
you?
I'm doing well.
Good.
How are you doing?
Doing all right, I think.
Do you want me to go ahead and just give an update time for timing, or what would you like me to do?
Update and where we're at on the 1115, because I think part of our challenge with the TAC is once the 1115 happens, I think we'll have more substantive conversations around that. We'll have people who are experiencing things. Many of the TAC members will know folks who are in the process and or interact with them. I think it
Sure.
becomes more viable. At this point, we're trying to figure out what to do until that transpires, right?
Correct. And I thought I would give you, just while I'm on the phone with you today, Steve, just give you a couple other updates, just DMS related. I kind of feel like a lot of our tasks are kind of flowing over into each other right now and may affect each other down the road. So I'll just give you a couple of updates. And I've also asked Leanne Fitzpatrick if she's on, just to give you some numbers that you've asked for in the past, so that you'll have that as well. So, and forgive me if a little bit of this is duplicative. I'm sure if you all are on many meetings with me, you may have heard me say some of this stuff already, but I always kind of try to prepare in case somebody hasn't heard it before. So just the first thing right off the bat, we have the Mobile Crisis Intervention Planning Grant, and it runs from September the 30th of 2021 to September the 30th of 2022. It is a planning grant that we are in collaboration with our sister agency, DBHDID, to develop and plan for an all-inclusive model in the state of Kentucky for mobile crisis intervention. We're just in the planning phases. We're working right now on outreach, interviews, surveys. Some of you may have seen those, and working on a needs assessment, because that is required. I mean, we have to develop a needs assessment before we can go forward with the planning. So I think it's by the end of March, we'll have the needs assessment probably drafted for review. So another thing I wanted to mention to you was the SMI SED waiver. We are still currently working on that with CMS, and they have offered guidance to help us through some budget neutrality pieces. Our tentative drafting date, like to have it out there, would be probably the end of this year, the last quarter. So don't hold me to a specific date. I'm looking from the end of September through the end of the year. So that's kind of
the calendar year.
Well, for
That's
our
okay.
drafting. So if you remember, we have 11-15s right now, and CMS is trying to get them all kind of on the same dates. So we're currently right now looking at the last quarter of this year. Okay. Another thing I wanted to mention was the CCBHC. Of course, we started that January of 2022, and it will run for 8 quarters through January of 2024. Very happy that this program is going. It's our first really hard strive to get integrated care here in Kentucky. So this has been a big deal, and we have 4 of the CMHCs that are currently participating in that 8-quarter demonstration. We will probably start within the next couple of quarters thinking about how this will look after the demonstration, Steve. So anytime you want to add something to state plan or make any major changes, regulatory and things like that, you need to start about a year ahead of time, right? So that's kind of where we will be with the CCBHC. And final and foremost is the
at that point, would there be an opportunity to expand beyond the 4?
Oh, yes, we're going to take a look at that. Yes. Yeah, it won't look exactly like it does now. If you remember, I had reached out to CMS in the beginning to try to see if I could add on, and they said, no, you had to stay with that 2016 application. So,
right.
But we're lucky to be in the demonstration with Michigan, so we're happy that we got added on. And one of the last things is the incarceration amendment. It took CMS, they kept me apprised like monthly on our meetings. Very positive, very hopeful that this was going to go through. They were still trying to get their ducks in a row at CMS, not sure what they were going to even want in an incarceration amendment. If you remember, we're the first in the nation that's really tried this. We heard from them 14 months later, which is exciting. And they started conversations by just some simple things, nothing major, and then went right into budget neutrality. So we're currently working with the Department of Corrections right now to kind of synthesize the data that we gave them in the original draft budget neutrality wise. It's all about numbers right now. So when I have more information to share with you on that, Steve, I will. But CMS is also, because they do want this to happen, they are giving us free technical assistance through the budget neutrality as well.
Okay.
So I think.
And remind us what budget neutrality really means.
So budget neutrality, just about in any waiver, whether it be on the 1915 side or the 1115, means that during the demonstration or the waiver years that you won't spend any more money than you currently are, it's equal to or less than, with a better quality of life and a better outcome. Does that make sense? So we do think we can definitely offer better quality of life, better quality of care in Kentucky. We've identified some gaps that we need to try to help with within our correctional systems. They've done a great job. I have been so impressed with what they already have available and what they're doing. They have a SAP and SOAR program that we're kind of expanding on here in Kentucky. And they already have a division of substance abuse, which we, me not working corrections, I didn't even know that had occurred a couple of years ago. Very pleased. CMS seems very pleased that we're working with the Department of Corrections as well as our sister agency, DBHDID, and we're taking down the walls and working together. So they seem very appreciative of that. And we're supposed to be on a panel conversation soon with California, I think, who has done, I think they're just doing the 30 days prior to release part of the amendment. I haven't spoken with California yet, but that's going to be exciting. And our sister agencies will be on the call with Medicaid as a team. So that's all very nice. Steve, if you don't have any questions, I'm going to ask Leanne just to give you some updates on numbers, if that's okay.
Real quick, so the budget neutrality, you have to show this will save dollars.
Equal to or less than.
Equal to or less than.
Yeah.
For those folks who, when they're incarcerated, become Medicaid eligible.
Yes.
I guess one place might be accessing services more quickly, smoother transition, so there's not high-end costs incurred later.
That's correct.
Maybe prevent some hospitalization, some other things.
Yes.
Because it's really budget neutrality to Medicaid, not to the state budget, right?
Right. And what we're looking at is to cover pretrial members who in Kentucky often sit for a long period of time before conviction without services. We're looking at services during the time of conviction. And then we're also looking at 30 days prior to release. We will connect them with the MCO of their choice. And we will also, we would like to follow them for 12 months after they leave and have the MCO during that 30 days to help them establish, I'm not saying that they will provide this. I'm saying that they will help connect them to maybe physical elements that need to be treated, appointments, their community mental health center or other providers that they may have related to their substance abuse treatment, and maybe housing and employment. Now, I do want to mention that our SMI waiver as well, we're also looking at housing and employment there. So I can give you updates on that as well later.
I can tell you, Steve, I've worked on 2 of these. The budget neutrality piece is the difficult one. But, when we were working on this, these people were being entitled to these services anyway, in lieu of, whether they're arrested or not.
Right.
If it's medically necessary, then they qualify. So that was part of our argument was, it would cost you an awful lot more if you were providing them somewhere else other than DOC.
Yes.
Right. Yeah. I agree. I mean, I don't have, I'm on your side on budget neutrality. I think it's a tough topic to get to, and it's just challenging, but
yeah, I
A lot
will
of
say,
interest.
Steve, the 11-15s, because they're demonstrations, and especially on the new ones, they really tax us hard to provide metrics and to prove that it's been successful. So that's very important. We plan on doing some town hall meetings with the court systems. We've worked with Rachel Bingham on the ALC side, that we get out there and we're doing this as a team and talk to those folks about what our missions are for this waiver, and to ensure that, I think some folks were afraid that this might cause additional incarceration for the treatment, and that's not what we're trying to do. We're also providing in community matrix, like matrix information of what's available, so that you don't feel like you have to incarcerate at all. We've been trying to give them that information and share what our plans are for this population. So,
And Van, I think Senate Bill 90 kind of feeds into this, right?
yeah.
It really does. And the latest version of 90 came out last night. And looking at it this morning, it's the best version so far.
Mhm.
It's getting there. I don't think it's quite there yet. And Leslie, I'd be really interested in Medicaid's take on this latest version.
Okay, and I have not looked at the latest version this morning, so we can get together later if you want to. And Van, I think you're going to participate on the panel with us in California too.
Yeah.
Yeah. That gets heard today in Senate Judiciary, but doesn't mean it can't, they need
Yeah,
to
I
get
mean, and Westerfield said in his email last night, he was already made arrangements to work on the House side if there were changes that needed to be made.
Yeah.
So
those folks pay attention, General Assembly, the clock is ticking, right, Van?
Yeah.
And
this is the time of year you got to pay close attention.
Yes.
Yeah.
The quick.
15, 16 days in the General Assembly can be a blink, or it
Yeah.
can be a lifetime. It just depends on what happens going forward, but
Have to pay attention.
it's a good conversation to have on that whole Senate Bill 90.
Leanne, are you on? Can you provide some numbers for Steve?
Yes, ma'am.
Leanne, do you need to share your screen?
No, I just have two numbers to tell everyone. We have 1.6 beneficiaries currently, and currently there are 18,063 members that are incarcerated. I think those numbers pretty much stay static. And Leslie, did you want me to give an update on the reentry program?
If you have any updates that they haven't heard, I thought you might want to.
Sure, yes. The reentry program is moving along. We have all of our processes and everything in place. We have halted the monthly meetings for right now, simply because we don't have anything new. We haven't expanded. Everybody is, the program is working well the way it's supposed to. And last month, as I did my monthly report, turning benefits on after release continues to be improving. So there are increasing numbers that are turned on that day and the day after. So it's still looking good.
Because I know in the past that benefit time at release has sometimes been a challenge.
Yes, when we first started, there was some data ran that the average was 90 days, and there were some longer. The issue with that is that someone has to actually contact DCBS and say, hey, I'm released, either them or their authorized representative. So that is the one step in the process that has not changed, and does continue to be a barrier.
Yeah.
But with APRIS in, we're seeing that improvement. And APRIS is the system that talks with our Medicaid eligibility. And when someone is released, it immediately sends a signal over to our eligibility. And then when someone is on the same side, when someone is incarcerated, the systems are going to talk together and put the dates in there, where initially it had to be someone had to actually contact DCBS and say, hey, we have some incarcerated individuals. So that process is improving.
Did you see, Leanne, in House Bill 7 where they put that responsibility on the jailers?
No, but that's great. Did you say House Bill 7?
Yeah.
Oh, that would be great.
they put a responsibility of the jailer to notify you all if the person is there longer than 48 hours or if the person is 48 hours prior to release. I don't think there's any way for the jails to do that, you know, automated wise
Right, but
through their jail tracker system. I don't know about that.
well, that's a step in the right direction. Hopefully that
Yeah.
will get passed through.
That's something too, Leanne, we need to keep an eye on. Van, if you can help us, and we need to probably update the waiver.
Yeah.
Working on.
Yes.
There's a lot in that bill, and there's a lot of other problems in that bill.
There's a lot in that bill.
Yes. So yeah, it's a bill of concern because of some other issues, not because of that particular.
Yeah. I agree. I mean, part of it, I mean, folks coming out, you know, reentering, you know, we want to get them to work as soon as possible, but that's a challenge for some folks, right? And part of House Bill 7 looks at that piece again, which is, you know, I just think it's the fewer barriers folks have reentering, the better off we'll all be, right?
I'm sorry, I didn't hear you.
I said the fewer barriers folks face reentering, the better off the system is for those folks, right?
Oh, yes.
You know, and that's kind of a concern we have, is that maybe, and I think Adrian just weighed in as well, that she thinks there'll be more barriers because of House Bill 7. But we're all paying attention to it. Right, Adrian? She's muted.
Yes, Steve, definitely. And I'm sure we'll talk about it under the General Assembly updates, because I'm sure people
Right.
have lots to say, because as Van said, there's a lot in that bill.
Yeah. Yeah. Does anybody, you just have any updates they want to provide, TAC members? Okay. Adrian, you want to kick us off on the General Assembly updates?
Oh, goodness, sure. I can get us started at least. As far as what we are looking at, some of the good things that are happening is, one is House Bill 197 that is related to identity documents specific to people experiencing homelessness. This bill was filed by Representative Randy Bridges and finally got heard in the House Transportation this week, and is moving through the calendar process in the House. So it basically streamlines the process for people who are experiencing homelessness to obtain a legal ID. A lot has changed in the last 10, 11 years since the General Assembly created this legal pathway. And so we want to update some things. It also allows 16 and 17-year-olds who are unaccompanied and experiencing homelessness to obtain an ID legally without parental consent. And then the last thing is it reduces the cost. One of the problems with the last Real ID legislation is that the cost jumped up to $10 per ID, and this would take it back down to $5. So Senate Joint Resolution 72, I'm sure a lot of folks on this call are familiar with, would direct the Cabinet for Health and Family Services to apply for the SMI, severe mental illness waiver. And it is scheduled to be heard. It's passed the Senate, scheduled to be heard in House Health and Family Services today, actually. So we're excited about that. And then we've got a lot of good landlord, tenant, and housing bills that have been filed that, of course, are not moving. But I'm going to put our bill tracker in the chat, and anyone is welcome to check those out. One last bill that I wanted to mention specific to Medicaid that we are supporting is House Bill 525, Representative Moser, that would allow the state plan amendment to, or the state plan to be amended so that Medicaid can be billed for community health worker services. So we're excited about that. We think the CHW model is really great in addressing social determinants of health, including housing. And in fact, we have, although we are not a Medicaid biller, we do have a privately funded CHW on staff that has been tremendously beneficial. So, and then of course, House Bill 7. There is just, you know, as we talked about, there's a lot here around SNAP, Medicaid. Our concern is for people who are experiencing housing insecurity, whether they're reentering from incarceration, experiencing homelessness, simply unable to pay their rent without additional support like SNAP and Medicaid, that this is just going to make it harder and produce a lot of tripwires that will make people more likely to lose coverage. We know from the Census Household Pulse Survey data that has been compiled in 2020, 2021, even into 2022, a lot of people have been, you know, really struggling to make ends meet, and have been using, you know, SNAP to help pay for groceries, which then allows them to pay for rent, utilities, that sort of thing. And then the other piece of it is that we're concerned about, particularly on the SNAP side, is the piece of the bill that, you know, says that everybody using SNAP should spend at least 75% of their allotment on healthy, fresh foods. They should all go to the farmer's market and use up those double dollars, which is great. But farmers markets are not in every community. People in rural communities can't necessarily just walk up to the farmer's market. And there are at least, you know, from American Community Survey data, we know that there are at least 12,000 houses in Kentucky that don't have adequate kitchen facilities. And that's what you need for preparing and storing fresh food. As well as people experiencing homelessness, receiving SNAP. If you are literally unhoused, I'm not sure where you're supposed to, you know, store all your Honeycrisp apples. And I think the other real piece of concern from housing providers' standpoint is just the amount of money it will cost to administer the provisions of House Bill 8, the administrative burden on the Cabinet for Health and Family Services, particularly the Department for Community-Based Services, makes this bill, the provisions as it currently stands, unworkable. And it really, it is going to create further burden on the people who use these programs when they need them. And then, quite frankly, the homeless shelters and food banks and those in the nonprofit sector, trying to pick up the pieces. So we think it needs some work.
The other issue I had, one of the other issues I had with it, Adrian, was you know, it requires an expansion population to this community involvement piece, but it makes no reference to, is a residential treatment program considered community engagement?
Right.
If you're, you know, if you're in a long-term residential program, you can't go out and do 80 hours a week worth of community engagement. Of course, the other way, we're going way back, we did address that. That was a community engagement, you know, if you were in a recovery program or a long-term residential program. But this bill's silent on that, which is bothersome.
Yeah.
Well, and I think there is an assumption baked in there that people who use SNAP or Medicaid are not engaged in their communities, and that just empirically is not true.
Right. Yep. Yep, and I'm concerned about the 75% on fresh fruit and vegetables because I love fresh fruit and vegetables, but they're costly, right? You know, and maybe farmer's market, but yeah. So if you're spending 3/4 of your benefit on that, what's left to get, right?
Well, and I mean, there's an assumption there because fresh fruits and vegetables and food, like it all takes time to prepare. Time that people who are struggling to survive probably don't have. And again, there's just an assumption baked in there that people who are poor just, don't know what they're doing in terms of their decision making. And I find that really, really offensive.
Mhm.
Hi, Adrian. This is Dr. Terrio. I agree. It not only takes time to prepare those foods, it takes knowledge and it takes equipment that many people, even if you're not homeless, if you don't have access to those things. And so I think it's just making more barriers, and it's going to be horrible.
Yeah, and the programs like Recovery Kentucky and Healing Place and others pool those SNAP benefits of their clients and use them to feed them while they're in recovery housing. And this would certainly impact their ability to do that.
Mm-hmm. Yep. So got a rating, got assigned to Health and Family Services yesterday. I mean, it's not on the agenda today, but we all know who the primary sponsors are, right? House leadership. I mean, so it's scary. It's just, again, I think we're going after a population that has enough challenges already that we don't need to add to it. And Patrick Moynihan, the public benefits were so great, bankers would be on them. So, people aren't chasing this opportunity. I think that's the myth people talk about, right, Adrian? That, this is an opportunity, right? Wow.
I just think that there is enough in this bill, and I'll put the link directly to the bill, all 31 pages of it. Like, there is something for everyone that will impact everyone's work on this phone call, and the people that they love and care about. And I think it is tricky because of who is sponsoring this bill. And we all have other priorities that we want passed and stuff like that. But I think the more we can lift up concerns from diverse stakeholders, we spread the risk, for one thing. And then we also showed literally no one who is involved in these programs are asking for these provisions. Nobody is. The only, what Dan mentioned earlier, having the jailers do the thing with reentry. Okay, that's great. But I mean, that could be a standalone bill, or it could be wrapped up in a different criminal justice bill. The one thing that we're kind of intrigued by is the simplified application for people for SNAP who are above a certain age or disabled. Because honestly, the more we can simplify these applications, the better. So, I mean, that would be good.
Yeah.
But again, it's packaged up in all of these other detrimental things that just make it really, really hard to swallow.
It's a good summary. Thanks for that. And that's their bill tracker right there. Anybody else want an update from General Assembly? House passed their budget yesterday. I mean, the Senate passed their budget out of committee yesterday. Budget process is relatively ahead of where it has been previous sessions. I think, the Senate will take action and pass it out, I don't know, maybe Friday, Monday, and then a conference committee will be scheduled and go from there. So.
Steve, were you happy with the number of waivers included on the Senate side?
Yeah. It was 500 Michelle P. There's a waiting list. It's really chronological. That's a big deal. 200 SEL. And it's for some people, it's, we actually have an emergency waiting list for the SEL waiver, which is the definition of oxymoron, I think. You wouldn't want to call 911 and be told you're number 14 on the list. We'll get to you. But anyway, yeah, so I think that's the big deal. There's some funding to, those waiver providers are challenged hiring people. There's some money for that. And they put back in the not-for-profit funding pool that not-for-profits can make application to. It was in the governor's budget. The Senate put it back in, so we'll see where we're at. But yeah, the waiver slots, many more waiver slots than the House has. So that would be a point of, but maybe won't be discussed or not, in conference. So that's a big deal for those folks who are waiting. And it's that Michelle P is chronological. So, we all know who those 500 people are, so hopefully it'll happen. We'll get services pretty quickly. Anybody else? I keep asking for future agenda items. I don't get many, but I really do believe this thing will take off once we have people participating in that 1115 reentry piece that Medicaid and Leslie and Van have been working on, because then we'll have some real topics to look at and real things that will impact those folks who are accessing those services. So I think it will change our work at that point.
Yeah, I would agree, Steve. I think we'll see things adjusting as that moves forward.
Yeah.
I agree.
That'll create recommendations and things we can do, and maybe we'll hear things, or members will hear things that Medicaid won't necessarily have heard yet. That'll be an opportunity. I think, Van, you'll hear stuff from the correction side as well that I think will help shape things.
Yeah,
we
there'll
want
be
to
things
partner
we
with.
haven't even thought of yet that come up.
Correct. Yeah. We're the first state to even submit the application. So there's bound to be things that folks are going to tell us they're experiencing that will help.
Yeah, Steve, I was just going to share that as we meet with CMS, sorry, my camera won't come off. I'm sorry. As we meet with CMS on a regular basis, they have let us know that their guidance may change with us each meeting. So they told us to be patient with them. So yeah, they're just muddling through this too, trying to figure out what they want federally to look at, what the metrics would look at, what exactly it is. I mean, this is brand new to them too. So that I'm just so glad that we finally have made movement. So
Yes.
And we're very excited about this this possibility.
And I think folks on the TAC would be interested in discussion around those matrix and maybe some input on those as well.
Yeah, Leanne, do you still have those? I know we might need to update them. What we did, the matrix of the community providers in each area.
I have to look for that.
So we'll get that to you, Steve, and might need to take a look, see if it needs to be updated.
Okay. Meet again May 12th. Maybe we'll have more information then, and we'll have some idea where we're at. I don't feel the need to carry the meeting longer. If there's anyone else, please. Any other topic you want to discuss, let me know. I'll get the minutes out and I'll report to the MAC what we've done. But if that's it, I'm okay shutting down for today. All right. See y'all. Take care. Thanks. Bye-bye.